Hello everyone, welcome to my channel Anatomy by Dr. Vijaya. Today's session will be the second part of neuroanatomy of brainstem. So in my first part I had covered the external and internal features of medulla oblongata. So in today's session I will be covering the external and internal features of pons. So let's learn about the features of pons. So today's topic will cover the external features of the pons. In detail we'll be learning about the internal features, where we will be learning the pons at two sections. The section at the level of facial colliculus, which is the caudal part, and section at the level of main trigeminal nuclei, which is at the cranial aspect. So one section is at the caudal part of the pons, the other one at the cranial part of the pons. So here you can see, so the orange one here represents the pons. So posterior to the pons is the cerebellum. So in the development of the nervous system, the rhombencephalon divides into median and myelencephalon. So the median cephalon anteriorly develops into the pons, and posteriorly there will be development of cerebellum. So between that there will be a cavity, that's the fourth ventricle, okay, which you can see here. This is the fourth ventricle. So upper part of the medulla and the pons will form the floor of the fourth ventricle, okay, and the cerebellum will form, the parts of the cerebellum will form the roof of the fourth ventricle. So this is at the sagittal section, where you can see this is the location of the pons. So pons, basically it is resting on, if you see the cranial cavity, okay, the pons will be in relation to the clivus of the middle cranial fossa. So you know that cranial cavity is divided into anterior, middle and posterior cranial fossa. So the part of the sphenoid bone and the basilar part of the occipital bone, so they form a clivus, okay. So this the pons mainly rests on that slope, and you'll be it is also in relation to the diaphragma sellae. So here you can see this is the inferior surface of the brain. So pons. So this is showing the anterior surface of the pons. So at the midline there is a groove. So that groove is for this groove is called as a basilar groove, because the basilar artery lodges over here. So it rests on the basilar part of the pons, okay. So this is the basilar groove. The two vertebral, right and left vertebral artery, joins to form the basilar artery, okay. So after joining, the basilar artery rests over the basilar part of the pons. So here on either side, if you see the external features, so on the anterior surface, the pons has many transverse fibers. Those transverse fibers are arising from pontine nuclei, which is present over here, okay. So that we will be learning once we go into the internal features. So these transverse fibers, they all pass through the middle cerebellar peduncle. So you can see here the middle cerebellar peduncle is over here, which connects the pons to the cerebellum. So not only middle cerebellar, among the three peduncles, cerebellar peduncles, the middle cerebellar peduncle is the largest one. So you can also see the on the posterior surface, you will also see the superior cerebellar peduncle and inferior cerebellar peduncle. So they all merge together and they are connected to the cerebellum. So among the three cerebellar peduncles, the middle is the largest one. So these transverse fibers, they pass through the middle cerebellar peduncle to connect to the cerebellum. So they go to the cerebellar hemispheres. You can also see there are nerves, the fibers of the cranial nerves emerging over here. So near, this is the middle cerebellar peduncle. So here you can see a largest nerve fiber, the rootlet. So this is the trigeminal nerve, having the motor and the sensory component. So it has a thin on the medial aspect, a group of nerve fibers, so that is concerned with motor function, and on the lateral aspect a thick group of nerve fibers that is concerned with sensory function. Okay, so you have the trigeminal nerve over here. Then at the pontomedullary junction here, so you can see the emerging of 3 cranial nerves. The medial most is the abducent, the 6th cranial nerve. Then you can see the facial nerve. Again, facial nerve is a mix, so you'll be seeing 2 components, sensory and motor. And then lateral most you will be seeing the vestibulocochlear. So you can see over here, this is trigeminal nerve. Okay, this is abducent, facial and vestibulocochlear. So the 6th, 7th and 8th cranial nerve, they emerge, the rootlets emerge at the pontomedullary junction, but from the main body of the pons you will be seeing the emerging of trigeminal nerve fibers. So this diagrammatic picture you can see here, this is the groove for the basilar artery. Okay, you can see the nerves, abducent nerve, then you can see facial nerve having 2 rootlets, sensory and the motor. So motor is largest here, sensory is smallest. Then vestibulocochlear nerve, the 8th cranial nerve. Here you can see trigeminal nerve near to the middle cerebellar peduncle. So this has the largest sensory component and the smallest motor component, because motor component is mainly through mandibular nerve. The rest, maxillary, ophthalmic and the part of mandibular, will have the sensory component, mainly carrying the general sensation from the face area. So when you see the posterior surface of the pons, so here you can see this is the floor of the 4th ventricle. As I mentioned earlier, the lower part is contributed by the medulla and the upper part of the floor is contributed by the pons. Okay, so you can see a median sulcus over here. So this is there is a sulcus at the midline, so that's called as the median sulcus. Here on the lateral most aspect you can see, as I mentioned earlier, the largest peduncle is middle cerebellar peduncle. You can also see superior cerebellar peduncle, which is carrying fibers from the midbrain, and this is the inferior cerebellar peduncle. So they all group together here at the lateral most aspect of the pons at the posterior surface, and then they enter the cerebellum. On either side of the median sulcus you can see a small eminence, that's called as the medial eminence, and inferior part of the medial eminence you can see 2 swellings. So those swellings are called as facial colliculus. So why it is named as facial colliculus? Because it's mainly formed by the root of facial nerve, which winds around the abducent nucleus. Okay, so it forms a swelling here, the facial colliculus, which is seen on the inferior part of the medial eminence. So median sulcus, medial eminence, inferior part you are seeing the facial colliculus. Then here again you will be seeing a small ill-defined line. So this is a sulcus limitans. So you know what is sulcus limitans if you can remember the development. Sulcus limitans is the part which separates alar plate from the basal plate. Okay, so you can see the sulcus limitans here. So median sulcus, medial eminence, then you see the sulcus limitans. Okay, and this is the lateral area. At the lateral most area, that is lateral to sulcus limitans, you will be seeing the vestibular area. So all these facial nerve are concerned with efferent. Okay, abducent and facial, they are more of the motor component, so they mainly develop from the basal plate, and vestibular is a sensory component, afferent, so they develop from the alar plate. So they are the basal plate is differentiated from the alar plate by a sulcus called as sulcus limitans. So lateral to the sulcus limitans, so this area will be the vestibular area. Okay, so these are the external features of pons. So let us move on to the internal features. So as I mentioned earlier, so we will be learning internal features under 2 sections. Okay, the first section is at the level of the caudal part, that is at the level of facial colliculus. The other one is at the level of main trigeminal nuclei, which is at the cranial aspect. So before we go into the internal features, so I would like to present a vignette, a clinical vignette related to the clinical aspects of the Pons. A 46-year-old man with symptoms of deafness, vertigo and double vision, which is called as diplopia, visited his physician. On questioning, he said that he also suffered from severe headaches, which were increasing in frequency and severity. The week before, he vomited several times during one of the headache attacks. On examination, he was found to have a slight right internal strabismus. Okay, strabismus, usually in a layman term, they call it as squint eyes. Okay, so medically they are called as strabismus. So there are different pathophysiology, the reasons for strabismus. One of the most common cause is due to weakness of the muscle, okay, or non-functioning of the muscle, one of the extraocular muscle. So here it is internal strabismus, where one of the eye, you can see the patient is having on the right eyeball. So whenever you ask the patient to look towards an object, okay, so in this patient, since one of the muscle is not functioning, so his right eyeball is moving towards, is seen inwards, okay, instead of directing straight towards the object, it is moved inwards. So that's why that's called as the internal strabismus. Then on examining the face, there was flattening of the skin furrows on the right side of his forehead, okay, so there were no wrinkles on the right side, and a slightly drooping of right corner of his mouth, okay, so during drooping of the angle of the mouth on the right side. There was definite evidence of impairment of hearing on the right side. On testing for sensory loss, there was sensory impairment on the right side of the face. So mainly when they checked throughout the face, it was of maxillary and mandibular divisions of the trigeminal nerve. So once we know once we get to know the internal features, what are the structures present in the sections of different Pons, you will understand, and the functions of these nuclei, the functions of these fibers, you will be able to correlate with this clinical vignette. So let us move on to the features, internal features. So when a section is taken in the Pons, so internal aspect of the Pons is divided into two parts. Anterior part is called as the basilar part, and posterior part is called as tegmentum. Okay, for the descriptive purpose, they call anterior aspect of the Pons as basilar part and posterior part as the tegmentum. And the cavity enclosed by the Pons is fourth ventricle. And as I mentioned earlier, so at the level of the Pons, all the three cerebellar peduncle, so they join, okay, so they are close to each other and they reach their destination, which is to the cerebellum, that is superior, middle and inferior cerebellar peduncles. So first let us know the section through the caudal part, which is passing through the facial colliculus. So facial colliculus I have already shown in the external features. So at the inferior part of the medial eminence, you will be seeing a swelling called as facial colliculus. Okay, so in that section, what all structures you will be seeing? So cavity is same, fourth ventricle. Nuclei, so you will be seeing the facial nucleus, abducent nucleus. Also you will be seeing some of the vestibular and cochlear nuclei. Then spinal nucleus of trigeminal nerve. As I mentioned in my previous video on the features of medulla oblongata, the trigeminal nerve have their nuclei distributed throughout the brainstem depending upon, and they receive the fibers depending upon the sensation. So spinal nucleus is mainly seen in the medulla, but partly it extends to the caudal part of the Pons as well. Okay, so the fibers received by spinal nucleus is mainly, it carries pain and temperature sensation. Then you can also see at the basilar part the pontine nuclei, and also near to the between the basilar and tegmentum, you'll be seeing one more group of nuclei called as trapezoid nuclei, okay, also called as trapezoid body, and it also has one more olivary complex called as superior olivary complex. So they are together, okay. So these are the nuclei present in this section. Motor tracts includes corticospinal and corticonuclear tracts, then transverse pontine fibers and medial longitudinal fasciculus. So we came across medial longitudinal fasciculus even in the medulla, that is mainly the section at the level of open medulla, okay, but I didn't discuss about that because I'll be discussing in this video. The sensory tracts includes the spinal tract of trigeminal nerve, that is the fibers which are carrying pain and temperature sensation which comes and relays in the spinal nucleus. You will be seeing 3 lemnisci, okay. One is medial lemniscus. We already know what is medial lemniscus. So these are related to the dorsal column, which are carrying conscious proprioception, fine touch, 2-point discrimination, so which has crossed after relaying in the nucleus gracilis and cuneatus, the nuclei gracilis and cuneatus in the medulla. The second order neurons are formed, that is internal arcuate fibers. So they cross over in the medulla, okay. Once they cross over, they form a group of lemniscus. Those are called as medial lemniscus. So when they ascend up to the thalamus, they ascend as medial lemniscus, okay. So they are mainly carrying the conscious proprioception, fine touch, 2-point discrimination, okay. Then you have the spinal lemniscus. So these are related to spinothalamic tract, the lateral and anterior spinothalamic tract, which mainly carries pain and temperature sensation from the body, okay. So they grouped together. In the medullary section, it was separate, lateral spinothalamic and anterior spinothalamic, but once they ascend to the pons, so they form a group of nerve fibers, so they'll be called as spinal lemniscus. Then what is lateral lemniscus? So these lemniscus are related to auditory pathway, which I will be telling later. Then the cavity is 4th ventricle. So these are the main features seen at the level of facial colliculus. So you can see over here, this is the basilar part. As I mentioned, the anterior part of the pons is called as the basilar part and posterior part is called as the tegmentum. So here is the cavity of the 4th ventricle, okay. So you can see superior cerebellar peduncle, as I mentioned earlier. So though they are carrying fibers from the midbrain, they all join, they come close together. So here you can see middle cerebellar peduncle. So here you are seeing the superior cerebellar peduncle, okay. So you can see here this forms a facial colliculus, okay. Facial colliculus is formed by the root, the nerve fiber of the facial nerve. The nucleus is present over here, especially the motor nucleus, okay. But the root or the nerve fiber of the facial nerve, they wind around the abducent nucleus, okay. So once they wind around, they form a swelling over here. So you can see the swelling here. So that's the facial colliculus. So facial colliculus mainly contains abducent nucleus and winding of facial nerve fibers, okay. So this is the 2 nuclei. Then you can see here the spinal tract and the nucleus of trigeminal nerve over here, okay, which also extend till the caudal part of the pons. Then here, this is the medial or the lemniscus, okay. So you can see the medial lemniscus, spinal lemniscus, okay, and also this is the trapezoid body. So along with the trapezoid body, there is one more nuclei, olivary complex, that's called a superior olivary complex, okay. So these are, here you can only see the medial lemniscus and the spinal lemniscus. Lateral lemniscus is formed little bit at a higher part when the section is taken a little bit in a higher part, okay. So this is this trapezoid body and superior olivary complex are related to the auditory pathway. And also you can see vestibular nuclei over here. This is inferior cerebellar peduncle, okay. This is the vestibular nuclei, okay. And also there is anterior and posterior cochlear nuclei as well, okay. So facial colliculus, I've already mentioned. Nucleus lies posterior to the lateral part of the medial lemniscus. So posterior to the lateral part of medial lemniscus. So here you can see the facial nucleus. The facial nerve fibers wind around the abducent nucleus, producing facial colliculus, and they exit anteriorly, and the fibers are seen at the pontomedullary junction. Externally they are emerging out at the pontomedullary junction. So here you can see the facial colliculus externally. The vestibulocochlear nuclei, as I mentioned earlier, so they are group of nuclei. There is no only one nucleus, there are many. If you see, vestibular has 4 nuclei, medial and lateral, superior and inferior. Okay, so they are distributed at the most of it is seen on the pons, the caudal part of the pons, but some, especially the inferior and the medial one, are also seen in the medullary section, at the upper part of the medullary section. Then cochlear nuclei, there are 2 in number, anterior and posterior. So posterior cochlear nucleus is also seen, part of the posterior cochlear nucleus is also seen in the medullary section, that is open medulla section. So all these vestibulocochlear nuclei can be seen in the pons section. Okay, so they receive, these nuclei, especially the vestibular nuclei, they receive fibers from the vestibular nerve. So vestibular nerve mainly carries sensation of balance and head movement from the semicircular canal, utricle and saccule in the internal ear. So they carry that sensation which travels through the vestibular nerve and comes and relays in the vestibular nuclei. Cochlear nuclei, they receive fibers from the cochlear nerve. So they receive the sensation of hearing from the organ of Corti, which is located in the internal ear, which travels to the cochlear nerve and comes and relays in the cochlear nuclei. Okay, so these are concerned with hearing, balance and posture. Okay, and also it controls the head movement in different position within our space. Okay. Now coming to the basilar part of the pons, so you will be seeing many nuclei over there. So those are pontine nuclei which are located at the basilar part of the pons. So they are basically these nuclei have they receive fibers from the corticopontine. Okay, so from the cerebral cortex, some of the fibers comes to the crus cerebri of the midbrain. Crus cerebri is a part in the midbrain. Okay, so they terminate here, corticopontine, and from there the axons of these nuclei, from there they come to the pontine nuclei, and axons from these nuclei, they give origin to fibers called as transverse pontine fibers. Okay, and they these fibers cross in the midline, they intersect in between the corticospinal and corticonuclear fibers which are present at the basilar part. Okay, and they enter the middle cerebellar peduncle and they are distributed to the cerebellar hemispheres. Okay, so as I mentioned, so the information even from the cerebral cortex should reach the cerebellum, because cerebellum is related, mainly controls the voluntary movements along with basal nuclei and also from the cerebral cortex. So those information goes to the cerebellar hemisphere through these fibers, the transverse pontine fibers. So once the corticopontine fibers terminate here, then they come to the pontine nuclei, and from the pontine nuclei transverse pontine fibers arise. They cross, intersect between the so they form different bundles. So they intersect in between corticospinal and corticonuclear fibers, and they enter the middle cerebellar peduncle and they carry the information to the cerebellar hemispheres. So this connection, so this forms a main pathway linking cerebral cortex to the cerebellum. So you can see those fibers here. So this is the bundles of corticospinal and corticonuclear which are separated due to the intersection of these transverse pontine fibers. So these are transverse pontine fibers which are entering the middle cerebellar peduncle. So here you can see bundles of corticospinal and corticonuclear. Corticospinal, it's also called as pyramidal tract. okay, which goes to the spinal cord at different level. Corticonuclear fibers are those fibers which are coming from the cerebral cortex and goes to the different cranial nerve nuclei which are located in the brain stem. Okay, so even the cranial nerve nuclei, they are controlled from the higher center. So they are controlled through these corticonuclear fibers. So these are the fibers which are going to the cranial nerve nuclei located in the medulla. That is glossopharyngeal, vagus, cranial accessory, that is, and hypoglossal. Now you can see one more group of fasciculus. You had come across this even in the upper part of the medulla and now in the pons. So these are medial longitudinal fasciculus. So what's the function of medial longitudinal fasciculus? If you can see over here, so near to the cavity, so here this is the facial colliculus. So near to the fourth ventricle cavity, you will be seeing this group of fasciculus or group of nerve fibers. So they are called as medial longitudinal fasciculus. So what's the function of medial longitudinal fasciculus? So they are situated, located beneath the floor of the fourth ventricle on either side of the midline. So their main pathway, it's the main pathway that connects vestibular and cochlear nuclei with the nuclei which controls the extraocular muscles, which supplies the extraocular muscle. That is, your extraocular muscles, you have superior rectus, inferior rectus, lateral rectus, medial rectus, then superior oblique, inferior oblique. So all these are extraocular muscles which are supplied by third, fourth and sixth cranial nerve, oculomotor, trochlear and abducent. Okay, so this fasciculus, they connect vestibular and cochlear nuclei to the cranial nerve which supplies the extraocular muscles, and also to the spinal part of accessory nerve which mainly supplies sternocleidomastoid and trapezius. Okay, so you can imagine if you hear something from one direction, you tend to move your eyeball and also you move your neck. Okay, so this connection, that the signal which is coming through the hearing, which travels through the cochlear nerve, okay, the sensation which you hear, so you respond by turning your eyeball or by turning your neck. Okay, so this is mainly coordinated by medial longitudinal fasciculus. Okay, and also whenever you move, whenever there is head movement and eyeball movement, even the position changes and there should be control of the balance and posture. So that is helped by vestibular nuclei. Okay, so this mainly coordinates the movement of the head and neck and also movement of the eyeball according to the stimulus coming through the hearing. Okay, the cochlear nerve, which is the one which carries the hearing sensation, and also it helps to balance whenever there is head movement. Okay, so that is the main function of medial longitudinal fasciculus. Then if you can see medial lemniscus, there is change in the direction compared to the medulla and the pons. So this is the medullary section at the open medulla. Okay, so at the upper part, the cranial most part of the medulla. So the medial lemniscus was placed vertically. Okay, so once it comes to the pontine area, it rotates as it rotates as it passes from medulla to the pons. Okay, so in the medulla it was vertically placed, but once it comes to the pons, it is horizontally placed. Okay, so it was vertical in the medullary section, but once it comes to the pons, so it is horizontally placed. So there is a change in the direction, so that you have to know. And medial lemniscus is accompanied by two more lemnisci, that is spinal and lateral. Spinal I have already told. The spinal lemniscus is nothing but the fibers of lateral and anterior spinothalamic tract. Now coming to the next section, the section through the cranial part of the pons, which passes through trigeminal nerve nuclei. So in this section, definitely if it is passing through the trigeminal nerve nuclei, you will be seeing main sensory and motor nuclei of trigeminal nerve. as you know, the sensory nuclei of the trigeminal nerve is distributed throughout the brainstem, spinal nucleus in the medulla, then main sensory in the pons, and mesencephalic in the midbrain. So spinal nucleus receives sensation of pain and temperature. Main sensory mainly receives the touch and pressure, and proprioception goes to the mesencephalic, which is located in the midbrain. So here, since it's the pons, so you'll be seeing main sensory nuclei and motor nuclei of trigeminal nerve. Then pontine nuclei same, trapezoid also it's same. Motor tracts includes corticospinal and corticonuclear, transverse pontine fibers, medial longitudinal fasciculus. So all these remains the same, and the lemniscus sensory tracts are lateral, medial and spinal lemnisci. Cavity, again it's the same, fourth ventricle. So here is the section. So you can see the two nuclei over here, the motor, and this is the main sensory nuclei. You can see the spinal lemniscus, formation of spinal lemniscus here, then medial lemniscus, and also you will be seeing the lateral lemniscus. Okay, so these lateral lemniscus, these are the fibers coming from trapezoid body and olivary complex, superior olivary complex. So trapezoid body and superior olivary nuclei, so they run transversely in the anterior part of the tegmentum. So this is the tegmentum part. So the anterior part, you will see this trapezoid body and the superior olivary nuclei. So they are related to auditory pathway. So once the cochlear nerve and the cochlear nerve, which is carrying the sensation of hearing, so they come and relay in the cochlear nuclei, which, so you know that cochlear nuclei are two in number, anterior and posterior cochlear nuclei. So the cochlear nerve, which is carrying the sensation of hearing, they relay in the cochlear nuclei. So these are first order neurons. So cochlear nerve is a first order neuron having a peripheral process and a central process. So the central process comes to the cochlear nuclei, which are located anteriorly and posterior to the inferior cerebellar peduncle. Okay, so from there second order neuron arises. From the cochlear nuclei, second order neuron arises. So those fibers from the cochlear nuclei come to the trapezoid body and superior olivary nuclei. Okay, so they receive second order neuron fibers from cochlear nuclei, and from there, from the trapezoid body, the third order neuron arises. So that third order neuron group together to form lateral lemniscus. So the efferent fibers which ascend through the pons and midbrain, they form a tract called as lateral lemniscus, so which are nothing but the third order neuron which are arising from trapezoid body and superior olivary nuclei. So these second order neuron which are coming from cochlear nuclei, they cross over. Okay, some fibers cross over, but some relay in the same side. Okay, so you will be seeing in the lateral lemniscus both crossed and uncrossed fibers, since some are crossing and some are not crossing. So if you see the group of fibers in the lateral lemniscus, you will be having both crossed and uncrossed fibers. So after that they ascend up, forming a tract called as lateral lemniscus. So this goes to the midbrain. So midbrain there is a colliculi called as inferior colliculus. So they relay over there, and from there they go to the medial geniculate body, and from there they go to the higher centers. Okay, so this is related to the auditory pathway. So trapezoid body and superior olivary nuclei are related to auditory pathway, and this also mentions the formation of lateral lemniscus. So that's about the internal features of the pons. So let us move on to the clinical aspects related to the pons. So since pons is a part of the fourth ventricle, so it forms the floor of the fourth ventricle, and definitely there will be increase in the pressure due to the amount of cerebrospinal fluid over there. So if there is accumulation of CSF or any blockage, so that can lead to raise in the intracranial pressure, and tumors of the pons are also common. So the most common one is the astrocytoma, which mainly occurs in childhood. Okay, so all these clinical conditions can lead to neurological deficit. So one of the reason is increase in the intracranial pressure, the other one is tumors, the other one is the blockage in the blood supply. Okay, so it can lead to infarction, so even that can lead to neurological deficit. So whenever there is tumors of the pons, the most common tumor of the brainstem is astrocytoma. So it depends upon which tracts or which nuclei are compressed due to the growth of the tumor. So if there is compression on the facial nerve nucleus, the patient will present with ipsilateral facial palsy or weakness. Okay, so they can present, you can, the vignette which I mentioned before I started with the internal features. So the patient had right side loss of furrows, that is the wrinkles on the forehead, then they had right side drooping of the angle of the mouth. Okay, so these are the features of facial weakness or facial palsy, which is seen on the ipsilateral side. Okay, because the damage has occurred below the crossing. Then abducent nerve nucleus. So if abducent nerve mainly supplies lateral rectus, which is the extraocular muscle. So lateral rectus mainly helps in the lateral deviation of the eyeball. So the patient will have ipsilateral weakness of lateral rectus. So they will present with internal strabismus. So whenever you ask the patient to look towards an object, okay, so the part which is affected, the lateral rectus which is affected, so the eyeball will be it will be directed inwards. Okay, so the patient will have difficulty to move the eyeball outwards, and always the eyeball will be in the inward direction. That's called as internal strabismus, and the patient will have, usually they present with double vision, which is called as diplopia. Then if there is compression on the vestibular nucleus, so it is related to balance. Okay, so the patient might have nystagmus, oscillatory eyeball movements, or sometimes they might tell they have vertigo, okay, or dizziness. Okay, and if there is involvement of cochlear nuclei, the patient will have ipsilateral impairment of hearing. So in the vignette, the patient had right side hearing impairment. If the trigeminal nerve nucleus is involved, so the patient, it depends. If you see, the sensory component is on the lateral aspect, motor component on the medial aspect. So if the motor component is compressed, so the motor component, mainly the fibers passes through mandibular nerve, which supplies the muscles of mastication. Okay, so ipsilateral weakness of jaw muscles, and also there will be loss of light touch, because the main sensory nucleus is affected over here, and they receive the sensation of light touch. The pain and temperature is mainly by the goes to the spinal nucleus, which is located in the medulla, but main sensory, it gets fibers which are carrying the sensation of light touch, which will be lost in the patient. But pain and temperature remains normal. Even the joint movement, the proprioception, the appreciating the joint movement is intact, because it goes to the mesencephalic nucleus, which is in the midbrain. Then if there is compression on the corticospinal fibers, so since it is above the crossing, so the patient will have contralateral hemiparesis, okay, a weakness. Hemiparesis is weakness, so sometimes it can be hemiplegia. So most commonly it is hemiparesis, a weakness on the contralateral side. If medial and spinal lemnisci are involved, so again it is above the crossing. So so medial lemniscus, they cross at the level of medulla, and spinal lemniscus at the spinal cord level, that is spinothalamic tract. So the patient will have contralateral sensory deficit of the trunk and the limbs. So all the sensation will go, because medial lemniscus is concerned with fine touch, 2-point discrimination, proprioception, that is joint sensation. Spinal lemniscus is carrying pain, temperature, the crude touch and pressure. Okay, so all these general sensations are lost on the contralateral side of the body, that is the trunk and the limbs. So depending upon the nuclei, the tracts involved, so the patient will have those signs and symptoms. So as I mentioned, there can be infarction. Can be due to thrombosis or embolism of the artery which supplies the pons, that is basilar artery, or its branches. So depending upon where the infarction has occurred, so if the infarction can involve the paramedian area of the pons, so on the paramedian area mainly it has corticospinal tract, pontine nuclei, and the fibers passing to the cerebellum through the peduncles. So all those are located at the paramedian area. So that might be damaged. If the infarction is on the lateral area of the pons, so vestibular nuclei, trigeminal nerve, medial lemniscus, and also the middle cerebellar peduncle is also present over there. So that might be involved and they will be damaged. Okay, so accordingly, which nuclei and which fibers and which tracts are involved, so the patient will have those signs and symptoms. So this is my reference, the Clinical Anatomy by Snell. So that completes the neuroanatomy of pons. Thank you for watching.